Good morning, good afternoon, everyone. Thank you for joining. This is the second series of our webinars, the Governance, Ethics, and Conflicts of Interest in Public Health webinar series. This is webinar number 6. We're very happy to have two speakers that will be talking about regulatory capture, a key concept to enhance our understanding of corrupting industry power in the alcohol and food sectors. The webinar will be recorded and will be stored on the website of the network. For those of you who are not familiar with the network, in order to save time for the webinar, I will be posting some information about the webinar on the chat. My name is Rima Nakash. I'm from George Mason University. I'm a professor in global and community health. And I co-coordinate the network with my colleague, Dr. Mel Mayon from Trinity College, Dublin in Ireland. So to proceed with the presentation, thank you. I will present our speakers, Dr. Tony Brown and Dr. Hernando. Dr. Tony Brown is a sessional lecturer in the Newcastle Business School. In 2000, he was awarded an honors degree in law from Macquarie University and was subsequently admitted to practice law in the High Court of Australia and the Supreme Court of New South Wales. Around 2017, Tony was appointed as a conjoint fellow in the University School of Medicine and Public Health in recognition of his extensive voluntary community advocacy for an evidence-led approach to reducing the levels of alcohol-related violence. He holds a PhD in law from the University of Newcastle. His blended thesis incorporating public health and governance relates to the regulation of alcohol in New South Wales through a lens of regulatory capture. I also like to present now Dr. Hernando, who's a doctor of medicine from the National University of Colombia. He has a master's in sociology from the School of Higher Studies in Social Sciences of Paris. He is an associate researcher of the Pragmatic and Reflexive Sociology Group of the Higher Studies in Social Sciences of Paris School. He's a member of FIAN Colombia, an organization that works for the right to adequate food and nutrition, where he coordinated the nutrition line for 8 years. His commitment to political advocacy for the food cause led him to hold the position of coordinator of the civil society and indigenous peoples mechanism before the Committee on World Food Security in Rome until June 2023. He's currently preparing the groups of research on nutrition and chronic diseases. And of course, both speakers will have a wonderful presentation, and I look forward to getting questions from you either on chat or you can unmute and ask your questions towards the end when both presenters have completed their presentation. So Dr. Tony, would you like to go ahead and share your presentation?
Thank you very much, Rima. Hi, everyone. Good morning, good evening, good afternoon, and good night. The first thing I'd like to do is pay my respects and acknowledge the traditional custodians of the land where we meet here in Newcastle, New South Wales, the Worimi and Awabakal people. And I also extend my acknowledgement of those Indigenous people who are presenting and also tuning in to this outstanding presentation. Thanks very much again, Rima and GECIPH. I suppose the first thing I'd briefly like to do in a short period of time is define regulatory capture. And it's not a new phenomenon. It's been around since the antiquities, but some key elements of regulatory capture involve our lawmakers being unduly influenced by private or commercial interests. And as a result of that undue influence, they continue to divert public interest outcomes to their own private and reciprocating political interests. The interesting component about regulatory capture in the context of public health, it adds a whole new dimension and arsenal to our approaches to addressing the unhealthy commodity industries. And capture is recognised through a very normative sense, is the opposite of inclusiveness and fair law making. It undermines our core democratic values, public integrity, and of course, the rule of law. So in a very practical sense, I'm still receiving therapy for what's happened in Newcastle. In 2008, I helped lead a large number of the community in conjunction with the police address alcohol-related violence, which was the worst in our state of New South Wales. And it was done by the adoption of evidence-based measures such as modest reductions in late trading hours and sensible controls on the strength of alcohol served. Now, sadly, on the 4th of July this year, the New South Wales government, through skullduggery of the industry, took away Newcastle's life-saving alcohol controls. And in removing those controls to support the industry, there was a 60 to 8.
Because we cannot view your presentation.
Sorry, I must be on mute.
I'm sorry to interrupt you. I was just looking for the right time.
No, please tell me that. I'm just trying to unmute. Let me see. You can't hear me. Oh,
we can hear you. No, we can hear you, but we can't see the screen. You didn't share your presentation.
Oh.
Yes, perfect.
Can you see that now?
Yes, absolutely. Thank you.
I'm really sorry for that. You should have interrupted me
the
earlier.
presentation is really nice. I've seen it, so I wouldn't want anyone to miss it.
Okay.
Perfect.
So I paid my respects to traditional owners of the land, and you can see them there, the first white man painting of Newcastle, of our Indigenous custodians right near our university. So on the screen, the second slide was a definition of regulation. The third thing I said is they removed our life-saving controls on the 4th of July on the basis of their long trial that there was a 60 to 80% increase in alcohol-related violence, but the politicians and the industries declared that a success. So you can see how harmful and impacting, this concept of regulatory capture really is. Selda Unkala recently defined corporate political activity, and it's my perception that regulatory capture is a critical component of corporate political activity. Just to quickly summarise my research, I used a quite novel methodology in terms of the critical legal phronesis, and the phronesis approach is based on normative considerations in terms of are the conditions, the changes, just and so forth. So I encourage people interested in this area to have a close look at the legal phronesis methodology. And in my experience, many of us are afraid to use two words, the C words, which are corruption and capture. And as my research has revealed that there's a very close legal link between the concepts of regulatory capture and straying into the field of moral, intellectual, and even legal corruption. And I really think I'd encourage people to start using that concept of corruption as a process of regulatory capture, because it really resonates with the industry, but also the public. So drilling down, I synthesized a test for multidisciplinary capture, and there's three key components to that. First of all, connected conduct. There must be the intention, motivation, and reciprocation between the lawmakers and the relevant industry to switch the public interest to their own commercial benefits. Secondly is the normative consideration of public interests considerations, which can be divided into procedural aspects of the case, but also what are the substantial outcomes. And the substantive outcomes in Newcastle very recently was removing those modest alcohol harm controls. And the third leg of the test is a temporal, that it's got to be a pattern of behaviour over time. And I really think that this model is applicable to so many circumstances, just not the alcohol industry. It includes, for example, the environment industry, the food, and so forth. So it's a very useful test and detect and qualifying the presence of regulatory capture, which is not only bad for public health, but also impinges things such as the democratic process and the rule of law. So what we did was basically focus on those key pivotal points in terms of the regulation of alcohol. And a similar model can be conducted in different jurisdictions. But in terms of identifying legal determinants of health that complement social and commercial determinants of health, in all these pivotal areas of the regulation of alcohol in New South Wales was industry interference and undue influence. In other words, capture. The objects of the New South Wales Liquor Act were bulked up by commercial objects, and the objects of an act really create the goalpost in which the legal process operates. And so we saw the objects being really reorientated, an unlevel playing field to supporting commercial interests as opposed to public health alcohol harm conditions. The second area was traditional social impact assessments, which is supposed to be neutral and objective. But what the state government adopted as normal practice was social impact assessments, which were quick, easy, and cheap. In terms of another aspect, a key aspect of regulation is the amount of community inclusiveness. And what happened in one key law reforms in 2015 was that the community was entirely excluded for the introduction of these new alcohol law controls, including the fact that local residents were confined to a 50-metre radius from the violent local pub in terms of lodging an appeal against an increase of violence. The outlet approval process was commodified. The key test of approving problematic licensed premises was always it has to be in the public interest. But they changed the law surreptitiously to the process being not public interest, but customer convenience, which overrode the public interest. And we've also seen in the current paper we're working on is industry compliance standards, which is really important that we have effective compliance enforcement so that the industry starts complying with the law. They'd been significantly weakened, and there's so many different ways they've done that. And one of the critical ways of weakening compliance and enforcement was simply secretly reducing the number of government health inspectors, alcohol inspectors. So that shows you, I believe, where the legal determinants of health are a key factor and should be a collective factor, a joint factor on how we deal with these unhealthy commodity industries. So going back to that diagram, that circular diagram, I mentioned they bulked up the objectives of the Act to focus on commercial interests. They added extra legal provisions. There was a reduction in transparency and objectivity. They attacked appeals process and marginalised any fair community input. Outlet approval process was made dead easy, and I mentioned also the compliance and enforcement. I apologise for the speed I'm going through these, but I'm really like to stick to the time. So the main findings of my research, including 4 or 5 publications, is that capture by the alcohol industry of the lawmaking process over the last 8 years has intensified and diversified through all of those critical pivotal links in the regulatory change. Secondly, and I think this resonates the most in terms of public health and epidemiological research, is that industry emasculates the effectiveness of compliance and enforcement activities that can potentially render public health interventions useless. So whilst in Newcastle we had very effective public health interventions, if the government was not enforcing those, despite the proven evidence of how effective they are, it importantly can render these public health innovations, such as those in Europe, useless. So captures proliferated due to failure in governments, and we've seen the narrative approach is really important. Public interest being substituted by consumer convenience. That and the European model I'm talking about are the safer initiatives, but fortunately there's been greater emphasis on the process of capture. I won't read out those slides, but it's based on Fleischberg's, and I apologise for my pronunciation, based on Fleischberg's research about the importance of rationality, and those with power, as we've just seen in Newcastle, rationality went out the window. So please, if you've liked my presentation, send me an email or use my Twitter. These three codes here are examples of very profound narrative made up the research, and I encourage you to look at those later on. And lastly, and thank you for your attention, was a funny caption in a major paper in New South Wales, the former New South Wales Premier declaring, joke, with no further ado, I'd like to hand New South Wales back to its traditional owners, the liquor and gambling industry. So thanks very much, Rima, and I hope I'm on time.
Thank you. Thank you for this wonderful presentation. I hope we have time to talk about how public health advocates can face, in these contexts where there's government negligence, can face corporate interference. And thank you for presenting about this topic. We will move forward to Hernando Salcedo's presentation. Dr. Hernando, I will share your presentation, and please let me know if you can see it and indicate to me when you would like me to move forward in the slides.
Thank you very much, Rima. Okay. Okay, thank you very much, and thank you for the invitation, and thank you, Tony, for this excellent presentation. I want to share with you the topic of the problem of corporate capture of the food sector and how it is expressed at the global level, and with an example of the struggles and the activity at the civil society and indigenous people mechanisms. The next, please, Rima. First of all is my declaration of conflict of interest. I am an independent researcher, member of FIAN Colombia. FIAN is a civil society organization working for the right to adequate food and nutrition in South America. And FIAN is the old the first name is Food International Advocacy Network, and I have no links to or receive funding from the grocery, beverage, food, alcohol, medicine, arms, or infrastructure industries. The next, please, Rina. Okay. How does civil society operate in the United Nations system? This is the most important to understand what I want to say. The civil society and indigenous peoples mechanism is a unique scenario in the Committee on World Food Security since the 2009 reform. It is the civil society and indigenous people space, and it is a place where civil society and indigenous peoples can bring their voices to the Committee of Food Security. And it is a democratic, inclusive, and diverse space, and ideally it is an achievement of social movements, and is really unique in the middle of the UN system. We don't have other spaces with these characteristics in the UN system. The next, Rima, please. But in reality, the space is confronted to many difficulties, and the funding of the CSIPM depends on the resources from member states that choose or support it. And most of this support comes from northern countries. And if we take in account this, we can understand this is an exclusivity influence of the northern countries in the financial aspect in front of this space. And of course, this is a consequence of the capacity on financial support from member states. Financial support goes through the administration of the United Nations agencies in Rome, as FAO or IFAD and the World Food Programme, WFP. And this is a bureaucratic and complex interface, because it's not only bureaucratic, but is as an intervention directly to the gestion and the administration of the funds. The United Nations agencies in Rome are captured by the private sector, as is the reality of the World Health Organization. And probably Big Pharma is more powerful and probably acted before that we are now seeing on the FAO. But the reality is the capture is there, and I am going to give you an example. The next, please. This is one example. The data work stream on the world, on the Committee of Food Security. This work stream comes from a multi-year plan approved in the Committee of Food Security plenary. The plenaries are repeated each year in October, and the multi-year plan is a plan for 3 years, approved each 3 years on the plenary. And in this case, the data work stream was proposed by the Bill and Melinda Gates Foundation directly. And they have proposed this topic for the recommendations, for political recommendations from the Committee of Food Security 4 years ago, and the work stream is working now into the CFS and with the participation of the CSIPM. It aims to build a policy recommendations for the management of data related to food and agriculture. And of course, the approach is just to try to have all the control on the data about agriculture and food production. It is in the midst of the conflict of interests of member states that support the big data business. Is the case of the European countries in particular, and of course, US in the greatest form. The dissonant voice of the CSIPM is a drop in the ocean of the stream determined by private interests. We are before negotiations in July in the core of the Committee of Food Security, and the situation is really of complete capture. Next, Rima, please. Okay. To what extent is the presence of civil society and indigenous peoples justified in these scenarios? To what extent is the presence of civil society and indigenous peoples justified in these scenarios? This is the question. The presence in the United Nations system is instrumentalized to showcase a participation, but that is not real, because it is just a presence, and the capacity of advocacy in the system is not a reality. The CSP, GECIPH's capacity for real advocacy is minimal, as shown by its statement in recent years, in which it has refused to endorse policy recommendations in the case of food system and nutrition, agroecology, gender, and now data. And this is important to note. The topics of the political recommendations are very attractive, but in reality, the content of these recommendations are not directed to the most affected communities by the hunger and the malnutrition, and directed to the real complicated and critical situation for these different areas. The GECIPH funding are centralized by northern member states, and this is in essence determining a course of action. And the GECIPH constituencies are doing advocacy, and this advocacy is used as a screen to show that the CFS platform is inclusive. But I think in reality we are in another form of functioning in this space. Next, please. Okay. In a positive way, the local implementation of CFS recommendations are a possibility to have local interpretations and adaptations to the recommendations from the CFS, and many of the CFS recommendations can be reinterpreted at the local level to support advocacy processes. It was the case in different processes, in particular the Chilean, Mexican, and Colombian cases about, for example, front package labeling. And this local action requires regional networks and local advocacy with parliaments. This is the result of civil society organizations' field work and the applied practice of ancestral knowledge. But of course, in front of the parliaments, in particular in South America, we know the work of Melissa Mialon and others about the capture of the parliament spaces in local form, and this is the subsequent consequence of the global capture. Next, Rima, please. About this point, I want to emphasize the ancestral knowledge and the contrast about ancestral knowledge and the scientific knowledge. The contrast between these two forms of knowledge is part of a global priority agreement. I think for this, it is necessary to move away from the logic of scientific verification of traditional knowledge and integrate a kind of dialogue, because ancestral knowledge comes from other places and must therefore be respected in its context, and from other epistemologies. And we need to have a dialogue, not just to have a verification. Agroecology is the best example of innovation, for example, recognized by the context of scientific knowledge production. Is the case of the high-level panel expert of the FAO that recognizes agroecology is a form of collective knowledge applied to a better form of food production, and it is considered an innovation. And we can see different kind of scientific data to prove that. Next, please. Okay, in this slide, I want to show towards new civil society and indigenous principle platforms. I think is probably an option in the process of UN corporate capture. There is a structural effect that changes the perspective of civil society participation. There is a need to build networks that become democratic platforms for action and advocacy with local impact, and actors on the ground have the experience and can bring the voice to these platforms. Academia must break through with networks to fight conflict of interest. I think we need this convergence with the academic world and the actors on the ground. And this is very important. And in a certain form, I think Tony showed a kind of approach in this sense, and we can discuss it after. Next streamer, please. Okay, it's important to say after the exposition of Tony, probably the correct word to design this situation on the United Nations system is corruption. We are in front of a space created after the Second World War to establish a harmonious and peaceful form of actions with nations. And nowadays we are in front of completed capture spaces, and corruption is the form of actions we into the lobbies and into the different spaces. You can see it as if we have a place on the Committee of Food Security from civil society and indigenous peoples communities. We have a private sector mechanism present. In the private sector mechanism, Bill and Melinda Gates and other foundations acting, and now they are creating the philanthropic mechanism. And the philanthropic mechanism is a form of introduce with an euphemism the action of the private sector directly into the decisions of the UN collective plenaries for the policy recommendations. And this is a very critical situation, and the reason why I think we need to create other platforms in association with academic and scientific sectors and civil society and indigenous peoples communities, and to articulate the different forms of knowledge. Okay, thank you very much, and this is all from my part. Sorry for the English, is not my mother tongue, but I want to know if you understood all.
Thank you, Hernando. It was good and everything was clear. Thank you for the presentation. I indicated that we can take in questions for you and for Tony on chat, or if somebody would like to raise their hand and ask any questions. But I will start by one question, maybe to both of you, but more Hernando, with regards to your point about the involvement of academia and actors on the ground. But let me start with academia, since I'm an academician and I have interest in moving forward, advocacy against corporate capture. I've had experience with advocating against tobacco industry capture, and would like to learn from my experience and build on it to other industries, as we have more evidence being built around them using the same practices and strategies and tactics, not coming up with many new ones, using the same ones and learning from each other. From your experience, where do you have, what are the platforms that allow you to share this kind of data that you have and your viewpoints on corporate capture with academics and also with other actors on the ground, so that this knowledge is built on and people can actually advocate for what you're calling for?
Thank you, Rima. Yes, after the Food World Summit organized by the FAO in 2022, the sectors on the ground and the communities were in front of a form of a great capture to integrate into the food summit just one approach, commercial and technical and industrial approach for food topic in general. And from the ground, people have created a platform to resist to this imposition from the FAO. And this platform is growing more and more. And this is for me an example of a kind of spontaneous organization, because they are taking resources from their, each one put one part of the resources to build this space, and we can take contact from GECI and other platforms and from academia to these kind of platforms. In Colombia, for example, we have the network of the Right to Food platform, and this is another communitarian platform. And the idea, for example, is how to offer to GECI network all these references of platforms to try to integrate or promote contacts, because we need the academic approach to objectify the realities that are presented in these places. This is the reality that we are seeing now, and I think it's very important to articulate these spaces to the academic and to the universities, including. In Colombia, we have different examples from the University of Caldas and Valle University, articulating movements of civil society to the academia, not to produce the same kind of knowledge, but to dialogue between the different kinds of data and to conclude on an objective form. And of course, the academia needs to be free of conflicting interests.
Sorry, you're muted.
We don't hear you.
Excuse me, I said absolutely true, and not only free from influence, but cognizant of the destruction that such a interference from the industry results in. What are the outcomes of industry interference? It's important for academics to be aware of. Thank you. So definitely it's important to see and stress the issue of having various actors dialogue and share evidence, and of course the role of academics, but seeing also throughout the webinars that we are conducting as a network, and also today, the importance of having various expertise. So we have, from the legal side, we have lawyers, we have public health professionals, we have public policy leaders, and the importance of understanding across industries. And I always say that although I have very little knowledge about the food industry, but understanding, my understanding of the tobacco industry helps me understand how the food industry might propagate and what are the ways that will support, resisting such interference. I think we have one question. Any questions or points you would like to check? Judy, Dr. Makhul, you raise your hand. Please go ahead. You can unmute yourself and.
Judy, you're mute.
Hi.
Hello.
Hello. Thank you very much for this very interesting webinar. I have a question to Dr. Brown and to Hernando as well. So Tony, you were talking about very interesting the legal capture, okay, the capture of the legal determinants by the corporations. And I liked your the graph that tells us about the steps and the processes and where this interference happens, and it looks like it's all over the place.
Yep.
But my question is to you, first of all, how are corporations brought in, you know, in the US, in Australia example, how are they brought in? Is it they force themselves into the discussion, or are they invited in? And I think the answer to that question might help us understand how we can, you know, what some suggestions about how to stop this corporate interference. And to Hernando, and somewhat following up on Rima's question about the academics. So we're always assuming that academics are cognizant, to use Rima's words, and informed about corporate interference, and have this on their radar, at least minimally. But from our experience with the American University of Beirut, this is not the case. And I've been trying just at the faculty level, Faculty of Health Sciences, just to introduce these concepts, and through you know, having a seminar with a number of members of the GECIPH network, and people were interested. And then after that, a discussion session, people didn't come. And so I felt that there is lack of understanding about this, a lot of resistance, given
Judy,
that, you know, the economic situation.
I use sorry.
Yeah, so I just wanted to ask Hernando, just on that one, his suggestions of how to get academics on board. It's a long journey, but some tips would be great. So Tony and Hernando, thank you very much.
Thank you. I had a slide up there. We should be using more the C words, and I didn't mean to be in a crude Australian. But I think you've got to understand the overriding context. And one dirty word is capitalism. And within the framework of capitalism, you know, the large businesses have got there through capitalism, exploitation, and so forth. But one of their fundamental goals is, you know, reproduction and keeping on growth. So there's a lot of research about how does, you know, the industries exert undue influence. And there's a number of responses that, first of all, what I've recognised is there's a failure of existing governance mechanisms. So we have these legal safeguards in most Western nations to prevent corruption, but it's a no-brainer that clearly those existing governance provisions aren't working. So what, for example, the alcohol lobby is just one of many groups. Their role is to create a legal environment, a compliance environment, which maximises their profits and minimises their losses. So the ultimate goal for those industry is to become the de facto lawmaker. The alcohol lobby gets to write the law book literally in New South Wales. So we need a coalition, an alliance of just not epidemiologists, but we need to follow in some respects what the industry does. And I think we've got one important factor going for us, which the industry will never have, is trust and integrity. And perhaps more we should be playing that, being more assertive rather than, you know, and some of those academic disciplines are quite conservative. I don't say that disrespectfully at all, but it's just not a question of the epidemiological evidence. What we need to be saying as a blended part of that is saying, yes, but it also undermines our democratic process, the rule of law, which is a foundation for all democratic nations, and the civil society. So I think we've got the individual parts there, but we just need to be much wedded and much blended together and playing to our strengths and publicly criticising and using some of those C words, dare I say it. Does that make sense?
Thank you, Tony. Yes.
Yes, thank you.
What I can say you about this, about the complexity of the link of academia and civil society processes and advocacy in front of this situation is first, yes, the university is captured too on the contents of health, education, and other, and of course, agriculture, nutrition. All these spaces are on all these topics are captured because the program from this structure of the neoliberal and capitalistic form of action is to introduce the approach of commercial process on the educational level. But the original research about the link with health damage and all this commercial process is there, and if the researchers are not involved in the corporate capture, we can articulate this form of knowledge and the results from this kind of research to the action of civil society. And civil society needs this data to exert the advocacy. And if we have an alliance or a dialogue, is better and better. That's it. I think this is the example in Colombia for the front package labeling, but it's not easy. It's a very hard journey. I completely agree, but I think it's possible. And after, probably we need to work more and more about the contents on the educational programs in health, agriculture, and etc. This is, for the moment, my opinion and my little answer, but I recognize this is a difficult program, but I think it's possible.
Thank you, Hernando. Yes, introducing what commercial determinants of health is within curriculum, not only for public health professionals, but in other disciplines, so that early on, they're aware of this capture. And a very related a challenge you mentioned at the end that it's difficult. Chiara has a question in the chat mentioning resources, like how can public health advocates do that without the same resources? We know how much resources the industries have and what they use in to influence. So what would be your answer to that without the same resources?
I think it came from the lovely Scotland, from a public interest group there who are very good. The one role for us is to create an appetite amongst local constituents of politicians that we want a civil society, a non-corrupt society. We want to put public health above pub profits, for example, in the alcohol space. So I think, again, we got to kind of expand our collective knowledge and wisdom and experience and play a bit more politics. Because I think if a lot of ordinary community members were aware of just the conniving that goes on behind the scenes, for example, Newcastle, where a 60 to 80% increase in violence was applauded. Many parents out there that we need to, think about our target audience and again, play to our strengths about the highest profession in terms of trust is the medical profession. In Australia, ambulance officers and so forth. And I think we underplay our strengths there in terms of it's inherently political. You know, I mean, I know a number of my friends, highly respected academics, don't see themselves as advocates, but the work they do is valued the most highly by the, you know, by the public. When you're on death's door, you don't go to the alcohol industry. And I think we need to play to those respects and appeal to people. Those other issues are raised.
Thank you, Tony. Any other questions, Kiara? You're good with the answer. Do you want to extend any other questions through chat or in person? I think it's been wonderful that there's time to have that discussion. Yes, Tamrin, you can go ahead and unmute yourself. Hello.
I am from South Africa, the University of the Western Cape. And Hernando, this is to you. I think the world is quite excited about, you know, the front of package labeling in Colombia, and particularly the ultra processed food tax that is going to be implemented, because it's a first for the world. And I am just very curious to know, because I know that the food industry is, I'm sure, doing everything that they can to try and undermine it actually being put into place. And if you've got any lessons for the rest of us, South Africa is currently in a place where we've got a draft regulation open for public comment on front of package labeling and marketing restrictions. So of course, we're seeing a very active industry interference at the moment. And I'd just love to know if you've got any lessons to share with
us. Thank you, Tamrin. Yes, I think the process in Colombia is a real good and incredible example of alliance between all sectors without conflict of interest. Communities, indigenous peoples groups, civil society organizations, and academia. And the most interesting part of this process is probably the tax regulation approved by the parliament with a terrible fight in front of the power of the industry of beverages and food in Colombia. But the key to understand that is all this alliance was possible and built a very strong form of action on the social level with an impact, a very high level impact on the society, by the understanding the damage on health was directly related with the consumption of this kind of beverages and food. And not by the data, but by a communication strategy from the civil society sector. And after that, of course, we have the context of a new government in a very high level commitment about the problem. And the Ministry of Health was finally, during this new government, a promoter, adding to the social communication strategy. It was, of course, a very important part of the key. And in front of that, of this popular and general agreement, the industry has needed to accept the proposal for the taxes, and is incredible. It's a very strong law about these taxes, and I can say that for you and to share with the other. And we have 2 minutes left, and I stop here.
Rima, I'd like to commend Hernando for a fantastic presentation, a very humble but powerful presentation. But I also commend you and also the organisation GECIPH and all its members who I think got the our direction absolutely correct. So I commend you all. Thank you very much.
Thank you, both of you, for the presentation. It's very clear that, it's important to work towards this and advocate and have all actors on the same, having the same message going out, but also a window of opportunity where when governments change and you have, at one point, you don't have government support, you have to be ready when government is able to listen to sort of leverage on that. Thank you very much for your presentations. This presentation will be posted on the network's website, and I invite you to become members if you are not already members of the network. And I hope that the network promotes this dialogue that's very much needed on corporate capture. Thank you, everybody. Have a wonderful rest of your days. Bye.
Thanks, everyone.
Bye-bye.
Thank you, Tony and Rima.